In this video, I'm going to talk about second opinions. Why should you get one? What happens when you get one? What are the disadvantages and what are the advantages? So, what's an opinion anyway? Shouldn't a doctor be giving you facts? Well, really, what they're doing is they're taking the facts they know about you and your tumor, then they're taking their medical experience, even if they're young and early on in their training, they know a lot when they finish training, and then they're taking the information they know about you and your tumor, their experience and knowledge, and they're applying it to your case to help you make decisions, because you do have choices. Sometimes it feels like you don't. I've had patients say, well, I don't have any choice about this, and actually you do. So when you go for another opinion, what you're really getting is another set of choices. Now that doctor may tell you the choices you got were perfect. Now you get to decide between them. So they don't really take away that choice. And if that's what you were looking for, you may not get what you want from that second opinion. What's another reason to get a second opinion? Well, because your husband or your best friend who lives across country, or your mother or your daughter says you have to get a second opinion. We know that magazines are full with, if you have breast cancer, you must get a second opinion. So what are the advantages? Well, one really important advantage is that the pathologist at the place you go for your opinion will not get just your tumor report, the pathology report, but they actually get the original slides of the tumor in the breast, and if they were removed, tumor in the lymph nodes. So you can actually get some clarity if there were some ambiguous remarks made, or let's say it was a grade 2 to 3, they can actually weigh in on whether it was a grade 2 or 3 and give you a more definitive answer. So that can be very helpful, not just to you, but to the oncologist closer to home. So it can't be all that good. What are the disadvantages? Well, one disadvantage is it can add to confusion. Let's say you were pretty happy with your oncologist recommendation, and now the second oncologist throws in a monkey wrench into the works, and now you have to decide. So it can add confusion. And the other thing it can do is it can add in delay. It can delay your treatment by a couple of weeks, which usually isn't bad in breast cancer, but most breast cancers grow slowly. But you can actually, miss that appointment to start your treatment with the first oncologist. Again, this needs to be your choice, so I wouldn't use it as a reason not to get a second opinion, but it's something to keep in mind. So just to summarize, when should you get a second opinion? If you have an unusual case, and I didn't mention, but this is really important, if you don't have a good gut feeling about your medical team, that's a good reason to consider a second opinion. I've really liked talking with you today. If you like this, click like and subscribe, and in the comments, let me know if you want to hear something else.
Perfect. Okay.